Okay, if there is literally one universally relatable dread that we all share, it has to be the sudden, striking pain of a toothache. I mean, it never shows up at a convenient time, right? And when it hits you out of nowhere, you are instantly forced into making this crucial, sometimes panicky decision. You have to figure out, wait, do I need to get immediate help for this? Because that is the exact question you're faced with. Is this serious enough to call about today, or can it wait until next week? And look, getting this specific question wrong actually has very real consequences. We're talking about allowing a localized infection to spread into your jaw, or even worse, losing a tooth that could have easily been saved. So to figure out the right call, we're going to look at a framework used by trusted full-service clinics. Specifically, we're looking at Westpark Village Dental Care in Plano, Texas.
All right, let's just dive right into this explainer. Today, we are looking at a structured triage playbook to empower you to handle any dental crisis calmly. First, we'll decode your dental pain. Then, tackle breaks, chips, and knockouts. Next, we'll uncover the invisible threats of spreading infections. After that, we'll reveal what can actually wait. And finally, build out your emergency action plan. So, starting off with Section 1, decoding your dental pain, or listening to your symptoms. You know, pain is by far the most common after-hours complaint that dental offices receive. But as we're going to see, not all pain carries the exact same level of urgency.
There is a massive difference here between non-urgent and urgent pain. Non-urgent pain might just be a quick sensitivity to something cold or a minor soreness right after you eat something hard. That kind of thing can usually wait. But urgent pain? Wow, that is a completely different beast. That is a sharp, throbbing, constant ache that actually wakes you up in the middle of the night. It might radiate out to your jaw, your ear, or your neck, and you'll notice it gets significantly worse when you bite down. That is the kind of pain that absolutely demands same-day attention. So the crucial takeaway here is that those persistent, urgent symptoms usually point to one of three underlying issues. Either decay has finally reached the nerve, a crack has exposed the inner structure of the tooth, or an infection is beginning to form. And, well, the harsh reality, absolutely none of these are just going to resolve on their own without treatment. Catching them early gives you way more options. Let's move right along to Section 2, breaks, chips, and knockouts. This is all about what happens when physical trauma strikes. Because when you get a physical injury in your mouth, the severity of the damage completely dictates how urgently you need to respond. Think about the difference between a chip and a break. Got a minor chip with zero pain and no rough edge bothering your tongue or cheek? Okay, take a breath. That can safely wait for a regular appointment. But a severe break, that is a whole different story. If that break exposes the inner layer of the tooth, if it's causing you sharp pain, if it leaves a jagged edge that's cutting the inside of your mouth, or if it compromises the structural stability of the tooth, you need to be seen today. No questions asked. Now, what if we are talking about a knocked out tooth? This is, without a doubt, the most time-sensitive dental emergency of all. If this happens, here are the highly actionable steps you literally must take. Number 1, pick up the tooth by the crown, never the root. 2, rinse it gently with water. 3, try to reinsert it back into the socket and hold it there, or if you really can't do that, place it in a small container of milk. And 4, get to the dentist immediately. I really want to pause and emphasize one absolutely crucial number here. 30. 30 minutes. That is the realistic window you have to actually save a knocked out tooth. Every single minute matters in this situation, so you have to move fast. Okay, shifting gears to Section 3, restorations and spreading infections, or what we can call the invisible threats. Sometimes an emergency starts when a protective barrier is lost, which is exactly what happens when a crown or a filling pops off and leaves the vulnerable tooth underneath completely unprotected from bacteria and pressure. But even more dangerous than that are internal infections, like a dental abscess. You need to be super vigilant for specific warning signs here. We're talking visible swelling in your jaw, your gum, or your cheek. If that swelling is accompanied by a fever, a persistent nasty taste in your mouth, or if you see a raised bump on your gum line that looks kind of like a small pimple, you, my friend, have a spreading infection. And the scary part is, dental infections do not stay localized. They will literally travel down into your neck and surrounding tissues if you ignore them. Which brings us to a very important triage distinction. Like,
When do you just call the dentist, and when do you go straight to the emergency room? So if you have facial swelling with tooth pain or uncontrolled bleeding after applying firm pressure for 10 to 15 minutes, you call your emergency dentist. However, and this is a big however, if you have facial swelling accompanied by a fever or you experience literally any difficulty swallowing or breathing, that instantly elevates the situation from a dental emergency to a general medical emergency. In that case, you need to go directly to the ER. Don't wait.
All right, let's de-escalate the tension just a little bit with Section 4, what can actually wait. Because finding some peace of mind is just as important, and we really want to reassure you that not every single dental problem is a 5-alarm crisis. To give you a little peace of mind, it is completely safe to just go ahead and schedule a regular visit if you're dealing with things like minor tooth sensitivity that just kind of comes and goes, a tiny chip with no pain and no sharp edges, or maybe some mild gum irritation that settles down in a day or two. These are super common, mild symptoms, and they can typically wait for a standard scheduled visit without causing you any further harm. But hey, if you are ever sitting at home second-guessing yourself, listen to this direct quote from Westpark Village Dental Care. They say, "We'd far rather give you reassurance over the phone than have you wait on something that genuinely needed same-day care." I mean, that really humanizes the clinic, doesn't it? If you are ever unsure, just pick up the phone and call them. Which transitions us perfectly into our final section, your emergency action plan. Let's get into the immediate steps you should take and look at the safety net provided by Dr. Hurden's clinic. If an emergency does strike, here are your immediate go-to home steps. First, stay as calm as you can and call the clinic to describe your exact symptoms. You can absolutely take over-the-counter pain relief as directed while you're waiting to be seen. But please, please, please take note of this one specific warning. Never place aspirin directly against the gum or tooth tissue. People try this and it can cause really serious additional chemical burns and irritation to the area. Just don't do it. Now, let's look at the safety net a clinic should actually provide. When you're looking for comprehensive care like what is available over in Plano, a few key features really stand out. Most notably, Dr. Hurden personally handles all emergency visits. There are no on-call associates, which is huge. You also want to look for same-day care, sedation options like nitrous oxide and oral conscious sedation if you're a bit anxious, and straightforward financing where they accept most PPO and DPO plans and just file the claims on your behalf. And speaking of making things accessible, being prepared for an emergency doesn't have to break the bank. Get this, their in-house savings plan can be as low as $36 a month. That's it. And that covers 2 exams, 2 cleanings, and 2 sets of x-rays every single year. Plus, it gives you 15% off other services with absolutely no waiting period and no deductible. So, as we wrap up this explainer, I really want to leave you with a provocative question to chew on. Do you have a trusted dental emergency plan in place before the unexpected strikes? Don't wait for a painful, stressful crisis to start doing your research. Save the clinic's contact info today so you are fully prepared and calm for tomorrow's unexpected emergencies. Thanks so much for joining me, and stay prepared out there.